Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of what I call the Common Sense MD. Today's going to be great because I have Josh Davis, physical therapist and trainer extraordinaire, on again with me. Josh has been on here a couple other times, but he's got some new stuff to share with us as a longevity doctor and so-called fitness nut. I'm really interested in what Josh is doing. He is the owner of TriStar Strength and Rehab, and I think you're now located, and you've got your new place in Gray.
Yep.
And I refer you a lot of patients, and they come back raving about you, the work you've done. It's interesting to me because in talking to a lot of trainers, and what sets you apart, really, Josh, is that you're a physical therapist, so
Mhm.
you can evaluate their bodies and see what they're really capable of. Because a lot of this stuff with, if you just go join CrossFit or, whatever, then you're probably going to get hurt. Or you do some of these things that you watch on tapes and things like that that I used to do. You really need somebody, especially as you get older, there to evaluate what you're capable of and what you're likely to hurt, or you're probably already hurt in a certain way. But in any event, I'm really pumped up about this, especially your older adult small group strength and training sessions. For me and a lot of people my age, of course, I'm a baby boomer, but I still want to be as fit as I can be. I think it's the hallmark of better aging is fitness,
For sure.
and then of course, what you eat. But for me, and people, even like my son Ben, who's wanting to stay in shape, and he's in his late 30s. I'm really more interested in not hurting than I am, of getting maintaining a six pack abs and looking great, or maybe bench pressing 300 pounds and squatting heavy weights. I don't care anything about that anymore. All I
Yep.
want is really not to hurt and, to be more flexible, less stiff, have better posture and good balance. That's what I'm interested in. And I'm
Mhm.
even people your age and people Ben's age are really interested in that. So
Yeah.
I know you train a lot of athletes, but you're really pumped and focused, and as every physical therapist is. You just take it to a new level with all the strength and conditioning.
Yeah.
So that's what kind of I'm interested in. So talk to me a little bit about this new venture you're going on, and a little bit about your clinic, Josh.
Yeah. Yeah. So again, physical therapist, doctor of physical therapy, and then also certified strength conditioning specialist. So I went to ETSU, so they're very heavy sports science based, not so much in the rehab realm. So that's where TriStar has been built into what it is now. Is that whenever you come to our new clinic spot here in Boones Creek, is we've got treatment rooms, but then we also have like pretty state of the art equipment and sports science tech. So that's where the two worlds of strength conditioning and rehab, I don't view them as, like, I've always heard, bridging the gap. I don't like that term because I like more so let's just find a new road altogether, and it should be a
Mm-hmm.
spectrum of training. So you were talking about, we train athletes, and we do. We've got several athletes from jujitsu, from CrossFit to wrestlers to marathon runner and Ironman. So whenever we train those athletes, it's just a spectrum, right? So I'm a former athlete, played baseball ever since I was young, and every other sport too. So I'm 31 now. So now my training looks a lot different than what it did when I was 16, because I was basically Gumby and I could recover from anything that I felt like doing.
Sure.
Whether that was jumping, whether that was, go and play pickup ball for 2 hours or go to lift as heavy as I can all in the same day.
Those
Now
are
I
the
do
days,
that.
my friend.
Yeah,
I thought
100%.
they'd
I mean,
never end.
now I feel like I'm getting hit with a baseball bat every time I, try to go do some sprints. But to that end, is we view everybody, because we don't call our patients, right? They're clients, because we treat like we train and we train like we treat. But it's just a starting point on the spectrum. So say we've got an older adult that comes in with some of those typical injuries we see, like low back pain, hip pain, which are go hand in hand, which could lead to some knee pain or shoulder pain, whatever those big, movement deficits are or pain points. We break that down into, first of all, like you said, what are your goals? Because my goals have changed. and especially recently, after reading Outlive by Peter Attia, I mean that's been a a massive book as far as how
Great book.
I really look at performance, and is it
Yeah.
optimization or is it maximization? Because whenever you're maximizing, you're in a competitive realm, like you're competing for something. You want to maximize your
Right.
results. Whereas whenever we're really going after, sorry about that ding, whenever we're going after optimizing, that's trying to get all levels of fitness and pain points, whatever that is, up to the best possible point we can get. But we like viewing every patient or every client as like a cup of water, and we got to figure like how much where can we take from, but then add to, and like it's got to be level, right? We can't overfill our cup. So yeah, I mean, the big thing we focus on with our older adults is that type 2 muscle fiber training. So that's the power output. I think we talked about that on a
Yep.
podcast
Yep.
in the
Yep.
past.
Yep.
But there's a couple great studies that I was looking up, and we can add those as show notes if y'all want to definitely read those. But just found some pretty interesting facts there. So those fast twitch muscle fibers are rapid muscle contraction. So we're thinking, as we get older, if we have a slip and fall, this is how we can course correct and maintain our balance, right?
Mm-hmm.
So then we think about jumping, we think about sprinting, all those high intensity movements that as we get older, we just feel like we don't either need to do them or we hurt after we do it. So there's like the kind of the PT side of let's do this safely. So yeah, I mean, I'm big on doing that kind of power output training. But the one thing I did find is the study showed that during aging, a general decline of muscle mass started in the third and fourth decade. So that's me, right? Me and
Mm-hmm.
Ben, and is approximately 3 to 8% per decade of a decline. Then it
Yep. Yep.
accelerates after that sixth decade. So then there's also heavy correlation between females, especially because they lose bone mineral density a little bit quicker. So with hip fractures, type 2 muscle fibers were almost non-existent because they're just not moving
Interesting.
fast. But
Yep.
then they also weren't able to course correct if they had a fall. And same thing with males, as well. That was just that one study was looking at older females. But yeah, I mean, you look at sarcopenia, like age-related loss of muscle mass and strength, they go hand in hand. If we don't, it's not that we're trying to lift heavy, right? We're
Yep.
not trying to get on a platform and do these crazy power lifts, but we do want to lift heavy in relation to what they're actually wanting to do in daily life, whether that's
Of
pickleball or
course.
whatever.
Of course. That's interesting you said that with Dr. Attia, who I followed for years. And that's where hormones come into play too,
Hmm.
because you can't build muscle without hormones. When you get to that, that's why women get osteoporosis, osteopenia. That's why men get weak. They lose those type 2 muscle fibers because they don't have hormones. So hormone
Yeah,
replacement just kind of puts you on an even keel.
for
But
sure.
that's my job is to evaluate that. Then your job is to teach them how to do it because you have to
Yeah.
do it. Like you say, you have to have resistance training. But it's really interesting to me. Like I'm about to enter my seventh decade, and
Hmm.
so it's just interesting. You guys are in your 30s. I'm almost 70 years old. Wait till you hit this because it's even worse.
Yep.
Dr. Attia says that you know if you're not fit and you're not really in shape, when you turn 75 years old, it's like falling off a cliff. And I've seen that. When I got 65, I noticed, really harder for me to maintain strength.
Yeah.
And then, so my goal really is I really want to sprint. Just like you say, I want to be able to run fast. I don't want to run a marathon like my brother's running right now, doing
Yep.
great at age 66. But I don't want that. I really want to be able to sprint. You think that's possible for a guy like me?
Oh, 100%. Well, I mean, and it just boils down to knowing what you need to program. So when I say program, that's like your basic exercise split, right? So are you doing a bodybuilding style where you hit arms and chest on Monday? Everybody knows Monday is chest day, right?
Yeah,
So
yeah,
that's
yeah,
where I would say go to a squat rack and squat on Mondays.
yeah,
Nobody will be
yeah.
there, right? But we've got to think about, are we doing like a push pull legs type of split? So we got like an all upper body push to where we're doing like bench press, overhead press, whatever that is. That's gonna be one of our big pushing movements. Then we need a pull, so we need a row, we need a deadlift, something like that,
Yep,
to
yep,
hit the posterior chain, hamstrings. Then we need lower body, right? So that's a squat, that's a lunge. I'm huge on lunging. That's gait, cycle. So that's something that we get our hips in extension. So the knee behind the hip whenever we're in that lunge, because everybody's sitting now. And, I think if you can do 2 to 3 sessions a week, we're doing pretty good. Then you can build from that. Then you throw in that VO2 max, like we were talking about, that maximal, oxygen uptake for the cardio and aerobic and anaerobic side. And now we're really cooking, right? Now we've got cardiovascular, support as well, because I don't like running unless something's after me. But that's something like we're getting the VO2 max here in soon, for the testing center here at the performance lab, and I'm trying to train for that. um, but we've got an assault bike, that we're going to be testing it on, and it is
Awesome.
pretty gnarly. But
That's
that's
one of the
something that
most brutal
PRT speaks
machines
to.
out there. Yeah,
It
the
is.
assault bike is
And then you
incredible.
pair it with the VO2 max. It's going to be pretty
I did a
miserable.
VO2 max in medical school many years ago, over 40 years ago, and I'll never forget that was kind of torturous. But if you
Yeah.
read Atia's books and follow his blogs, and he's an absolute fitness nut. He's the longevity guru of the world, in my opinion.
Yep.
But he's big on the VO2 max for sure, and
Mhm.
that's something I'm pumped up about. That you're going to have an actual VO2 max. I mean, there's a lot of people that claim, well, let's calculate your VO2 max based
Yep.
on what your Apple or your Whoop Ring, your Apple Watch. You can't do that. You really need to put a lot of those things are very expensive,
Yeah.
and it's a really interesting test to do. And I'm going to be out there to test mine just to see where I am, because that's a very accurate measure of your longevity. You
100%.
need to lift weights, you need to build muscle, but you also need some cardio.
Yep.
I'm like you. I'd rather sprint. I have no interest in running marathon.
Right.
Um, but I want to be able to sprint and I want to stay strong, and
Yeah.
that's a good measure of it.
Oh yeah, for sure. Well, and like Peter T, like you were talking about the VO2 max, I found another study here, that's talking about, just all cause mortality. So they looked at, the testing the VO2 max, and they would have them in categories, right? So there was low fitness to elite. So there was a five-fold difference in mortality over a decade from the low fitness to the elite group. Now, elite, that's what you're talking about. You're competing, you're running a marathon, something like that, especially marathon and cardiovascular heavy, exercise. But then they put that in context in this study for other things like smoking, like coronary artery disease, type 2 diabetes, hypertension, end stage renal disease. So there was a 41% increase in mortality over the decade, and their coronary artery disease was 29%, diabetes was 40, high blood pressure was 21, and then end stage renal disease was the highest. But the end stage renal disease was at 180% increase in mortality, and that was the exact same as the low cardiorespiratory fitness, basically going from low to above average. So you put that in perspective, like, that's saying that a disease that affects your organs is just as bad as, basically being in poor cardiovascular health. And we're talking above average. You think East Tennessee, like, average ain't a high bar, to,
No,
get to. So, you think about, if you've ever been to a CrossFit class or any group fitness class, there's anybody that has gray hair that's doing the class and pushing it, everybody's like, oh my gosh, like, this guy's a machine or this girl's a machine. When in reality, like, why are we so taken back by something that should
yeah,
be normal? Does that make
yeah,
sense?
that's exactly right.
Yeah.
People don't know what normal is,
Yeah.
especially where we live.
Yeah. The
They
bar's
accept normal
lowered.
as being an obese person.
Yep.
That's just a normal person. It's really not. It's an abnormal person. It's
Correct.
very unhealthy. Dr. Tia talks a lot about zone 2 training.
Hmm.
Where and you need that, and that's not that hard to get. What a lot of people don't realize is you don't need to kill yourself.
No.
You need to get something that is reasonable, that's a routine for you, that's going to benefit you. I do a lot of, it's my job to figure out somebody's metabolism,
Right.
and look at their renal function, look at how their liver's working, look at all
Yeah.
their hormones. And we are seeing a lot of stage 3 renal failure. People don't
Hmm.
even realize it, but they've
Right.
had high blood pressure through the years. Maybe they've taken too many medications that have affected
Hmm.
their kidneys. But so it's your job is just as important as mine, because I can look at the numbers and kind of manage hormones, and
Yeah.
and maybe control their blood pressure, get their diabetes under control, and certainly help them lose weight because, you know, as everybody knows now, with all the advent of the new GLP-1 agonists, is that, people have certain metabolic diseases that they can't, train their way out of. They
Right.
just can't do it.
Yep.
So my job is to really get them to where they're balanced, and then your job is just as important because unless you move, you're gonna die early. There's no
Yeah.
doubt.
Well, whenever we think about everything that we've talked about today, it doesn't sound a lot like physical therapy traditionally, especially in this area, right? Like it sounds like, personal training, that kind of thing. But whenever you have a therapist, and we've got another therapist, Faith, here as well, that's really big into training too, that, whenever we're trying to really build this out, and Beth as well, she runs Ironman. She's, two kids, she's a machine. She absolutely crushes it as far as cardio goes. um, Faith and I, we just like lifting heavy and running fast every now and again. But yeah, I mean, I think, the big thing is, like you said earlier, making it consistent and being able to repeat it, right? Because if you just dread doing it, like you're not going to do a VO2 max test routinely. Like we're talking like
No.
quarterly, you know what I
Yeah.
mean?
Yeah.
And that zone two training, I actually started it this week in preparation for getting that VO2 max, machine here this week. And I mean, I did 15 minutes on a salt bike and I was absolutely demolished.
Oh,
It's and
yeah.
it's just so interesting because like, I got a 2-year-old son, almost two, chasing him around. Like there's times I get out of breath and I'm like 165, like, I feel like I'm in decent shape, but
I know.
it starts to really catch up to you, especially if you don't train it.
People are so different in their body build. Like I had a guy not long ago come to see me, and he was a big football player looking physique. I mean,
Yeah.
he was way over 200 pounds, very muscular, had played college football, and he's running marathons or trying to run marathons,
Mhm.
but he really gets hurt a lot, and his body is not a marathon body.
Yeah.
And I tried to tell him this. I go, I admire you for what you're doing, but
Yeah.
you got to be careful because you've got a different type of body. Do you ever advise people like that? Like, hey, you probably should redirect your focus on something different because your body is not made to run marathons.
Well, I mean, it's like trying to take a Hummer, cross country trip. You know what I mean? Like it's kind of not really built for that. But I can also appreciate, like, that someone is trying to step outside their comfort zone and try something new.
Me too. I mean,
But I think, that comes down to kind of what I feel like the whole thing with this conversation is like keep everything in moderation. Like, we don't want to be like a massive outlier in any direction, but we want to strive to be outliers, right?
oh yeah,
Like if,
for sure.
with your cardiovascular health, you want to be an outlier. With your strength, you want to be an outlier. Now you don't have to be, state level lifting champion or whatever, as far as like strength goes or anything else. Your VO2 max doesn't have to be elite. But I can guarantee you, if you're above average, we've already seen, like based on the research, how much that helps just being above the person that goes to Walmart. You know what I mean? Like
Yeah,
it's not
yeah,
a high bar, but if you don't know where to start, that's where it gets overwhelming. And that's kind of where we come in as far as these group classes that we're trying to do. It's going to be basically small group trainings where there's like 3 to 5 people max. That way we can keep, attention on each other. That way I'm not having to bounce around too much, Faith or I, or having to bounce around too much. But I mean, there's going to be barbells and hands, trap bar. Then we've got a Kaiser machine that it's a free motion machine that you can raise and lower, as far as the
yep,
arms go, but it runs off of air. So
yep,
it's more for
yep.
power output and moving quickly. But yeah, I mean, that's kind of the big thing is we're going to build an athlete profile to where we look at, the VO2 max for cardiovascular. We have force plates here to where we can see how much force you're putting into the ground. So we can do an
Oh,
isometric
that's
mid thigh
awesome.
pull. It's where you set up get in the squat rack and you set the bar at mid thigh and you try to pull the squat rack out of the floor. I mean, I'm screaming, everybody's screaming, music's loud, like it's intense, but the intent has to be very high. Then we get you on the force plates and do your jumping. That's your power output. And then we can compare the two numbers between pure strength and pure power and be like, how does that factor in with your programming? Because then we can shift. If your strength was high but your power was low, guess what we're doing? Not more strength, more power. So then we, hammer down
That's
on those
interesting.
deficiencies. But we've got the handheld dynamometry. We look at grip strength. We look at, every joint of the body. That way we can build an athlete profile and get a full look at the client, whether they're rehab, whether they're, strength conditioning, whatever they're coming, to us for. We want them to have the data support that, show the progression, but also it helps us make data driven decisions. And now we also use our coach's eye, and as far as people moving and stuff like that, that's the beauty
Sure.
of being a strength coach. But then we can also get them on the DEXA. We're going to have a DEXA scan as well, to where we're looking at bone mineral
Awesome.
density, muscle mass, body
Awesome.
fat, that kind of thing. So we're
Well,
excited.
you're doing it right. You're definitely an outlier. I mean,
Yeah,
I haven't really met anybody that does it exactly like you do.
yeah, it means a lot.
Doctor of physical therapy who's, you know, really in deep on the training aspect of it, on conditioning. You're right. Most people just ignore the cardio part of it and want to look good, but it's just really, I'm just so pumped up. You know what I've found in some of the people that I talk to, they're really more interested, instead of training athletes, is keeping older people healthier.
Yeah,
It sounds like you're getting that aspect to your, because I've always thought of you as a upper level athlete type
yeah,
physical therapist and trainer, but
for sure.
really I'm pumped that you're getting all this stuff to like check a VO2 max in a guy as old as I am. I really want to know what it is.
Yep.
I want to know, I want to live a long, healthy life, and
Yeah,
that's the way to do it. I mean, it takes a group effort, really.
it
You
does.
have to eat right, you have to exercise in the right way, you have to look at your hormones,
Yeah.
balance them out, you have to get a good night's sleep,
Yep.
you have to keep stress down. I mean, there's a lot of things you need to think about as you get older, and certainly what you're doing is just phenomenal. You're getting a DEXA, you're getting a VO2 max machine, you've got all the
Yeah.
equipment, and you've got these older group sessions that I really like. Do you
Yeah.
find that the group sessions are as effective or maybe more effective than the individual ones?
Yeah, yeah, I think it's more effective because then you see, for one, if they're former athletes, we're competing. Like you better believe I'm putting the everybody's mid thigh pull score up on the TV, and kind of pushing everybody and be like, hey, look, Sandy's crushing it over here. But like, whenever you have that camaraderie of like having a group of people that are going after similar goals, which I think longevity and all, lowering all cause mortality would be a pretty normal goal to have. But maybe somebody over here is wanting to be able to lift up their great grandkids, because they're the most, progressive overload that we can possibly have. They're going to get heavier. And if you want to be able to pick
Yeah.
them up or, play with them, whatever, get up off the ground, Kelly Starrett and Julie Starrett, they're, Kelly's a physical therapist, and, his wife, Julie, they wrote a book, and they talk about, all these blue zones, how you need to be able to get up from the ground without using your hands.
Yeah, yeah.
I mean, it's just
I work on
something,
that all the time. I work on
yeah.
that all the
And
time.
it's
I
a
tell my
beautiful thing.
patients that.
Yeah.
Yeah, and you can teach them how to do it.
Yeah.
People that can't begin to do it, if you teach them how to do it and they work on their balance, they can do it. And
Oh,
that
yeah.
could be a life-saving type thing. I
Oh,
don't want to rely
100%.
on an Apple Watch to alert somebody I've just fallen. I want to be able to learn how to fall, which we've talked about
Yeah. Yeah. Yeah.
before,
Right.
and how to get up on your own.
Yeah.
But very important.
Yeah.
All this
Well,
stuff
even,
really is important.
yeah. Well, even to that end, you're talking about like the Apple Watch comparison. That's just classic American way, right? Let's be like retroactive and not proactive. Like, how
Yeah,
about let's train, mobility, stability, and strength, which are three tenets that we operate off of here at TriStar. Like, why don't we maximize all or optimize all of those as much as we can? That way we try to prevent falls, right? Altogether.
yeah,
Now,
yeah,
there is utility, massive utility in knowing how to fall and how to get up. Don't get me wrong, but I think if we can train those fast movements, and plus they're just fun. I mean, once people get
yeah.
past like kind of the shock factor of you want me to do what? Like, I've not jumped in this many years, and it's like, believe me, we're gonna start on this progression, and it goes here. There's a very like systematic approach to how we're gonna go about it, especially if you've got some knee pain. I mean, everybody's got something going on, right? But that's where the physical therapy side comes in, because we know
I
what
love it.
tissues to
I
load,
love
what to
that.
unload. We can really tailor it.
There's something I just thought about. Because the group sessions that you do with older
Mhm.
folks, can you pick a group of your friends out and just say, "Hey,
Oh yeah.
these are my 4 or 5 group of friends I want to work out with," and do that, or is it more random?
No, I mean, I would honestly encourage that, because
Okay.
then you're going to be seeing those people outside of the clinic in the gym here, right? And with that, like with our workouts, I also have workouts that you do on your own through an app called True Coach, and it's got videos and there's adherence built into that. So if I see that somebody misses a workout, I get an email saying they missed it. So then I see, Tom, you missed your workout. Well, then they get a text from me, Tom, what's up, buddy? You missed your workout. We got to keep
I
this
love it.
going. But then
I
they can
love it.
also, kind of message their team too. So,
What's an
whenever
ideal size of the team? What do you like to do? Like, say you
three to
have a
five,
group of people, 3 to 5. Okay.
yeah, yeah, would be
Um,
ideal. And truly, that's mainly just because the space that we have is 2,000 square feet. But it just, we kind of have to be strategic with how the building is set up. So if we had more than five, it would be like I would have to bounce over here while
yeah.
somebody might be deadlifting over here, and it just wouldn't make a lot of logistical sense. So
And how often are they
3 to 5,
coming to the clinic?
yeah, we try for 2 times a week.
Twice a
So
week? That's
two,
certainly
yep,
reasonable. I think I'm going to get me a group together.
yeah,
Um,
for sure.
there's a lot of other stuff you can do. Like, I recommend as you get older, you take creatine. I'm big on
100%.
creatine.
That's what I got
Have
it
you got,
back here.
that's hilarious. I didn't even see that.
Yep.
But I put all my patients as they get young or old on creatine. There's a lot of misunderstanding. I did a podcast on it if you want to go back and look at it. But I think everybody should be on creatine. It will not hurt your kidneys. People say, well, it just causes water weight. Not, your muscles need water. They need hydration.
Yeah.
That's the way you need to think about it. So I wouldn't think about going a day without creatine for my muscle.
Yep.
That's interesting that you have it on your
Yep.
back thing there
That's a
as one
staple
of
for
your
me.
go-tos. But
Yep. Yep.
well, that's great to hear. I'm so pumped, Josh, about your new thing. Now tell me, as we conclude this, May 30th is going to be your grand opening. Is that right?
Yep, yep. So we're having a grand opening, kind of, I'm not gonna say extravaganza. It's not gonna have like, anything massive, but we're gonna have some food trucks here, hopefully, and a bunch of our affiliates. So y'all being affiliate, would love to have y'all here as well. We got a couple CrossFit gyms that are gonna be coming out, giving some prizes away. We're gonna have some prizes and have some of our best offers we've ever had as a thank you for attending the
That's
event.
awesome.
But you have to be here to claim it. So,
Sure, sure. So
but
is
yeah,
that
we're
on a
May
Thursday or
30th,
a
Thursday.
Thursday? Yeah, I'm
Yep,
going to be there for sure.
yep.
Performance Medicine will be there and
Cool.
supporting you. We're just so pumped up about what you're doing. You really
Yeah.
care, and that's cool. And you've got all these great qualifications. You're fit, and it's just wonderful. I know you
I
and Ben
appreciate it.
talk a whole lot about fitness and nutrition and
Yep.
training and all that, and I appreciate your friendship with him. But
Yeah.
Josh Davis, thank you so much. I'm really pumped up about TriStar, this new venture you're going on with all the cool stuff you're going to have. May 30th, your grand opening. I'll be there. And stay tuned. We'll do more of these podcasts, and you can keep us up to date on how to age better with not losing all the muscle. So
Love
thank
it.
you, Josh. Any other parting words for everybody that listens to this podcast?
No, just thanks for having me on, and I think it definitely is nice having a community that we can make a team. We've got you as the quarterback, and then we can kind of move around as far as what we need. We got gyms we're affiliated with, so if anybody needs anything training related, just holler at me. Definitely, I'm always available.
Thanks so much, Josh Davis. We'll talk to you on May 30th, and
Good
we'll
deal.
certainly continue this conversation. Thanks, guys. We'll see you next week.